Ladies and gentlemen, thank you for standing by. Welcome to the Statewide Early Childhood System Building Measuring Local Results webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Tuesday, May 14th, 2013. I would now like to turn the conference over to Jerry Cobb, State Services Director for the BUILD Initiative. Please go ahead.
Hi, my name is Jerry Cobb, State Services Director for the BUILD Initiative. Thank you so much for being here today. We have an unusually large number of people listening in on today's webinar. All 50 states, plus the District of Columbia and several U.S. territories, including Guam, Puerto Rico, and the Virgin Islands, are registered for today's call. So clearly this is a topic that a lot of people are thinking about. Due to the large interest in this topic, though, unfortunately that means we'll need to keep you all muted throughout the presentations. But feel free to send your questions through the chat box, and we'll ask your questions as we go along where it seems relevant, and then other questions we'll hold to the very end to make sure that we get through all the presentations. But please, just put your questions in the chat box and we'll respond from there. If you're having any technical problems, if you'll put that in the chat box as well, and we have several people who are responding to those messages, and we'll help problem solve what the issue is. But hopefully everybody will be able to hear this clearly, and we'll get everything you need from these presentations. So today you'll hear from 3 states that are working to build statewide early childhood systems and who have taken the approach of developing local or regional infrastructures to support their system building efforts. With everyone taking different approaches at the regional level, though, how do these states measure their progress on a statewide and local basis that shows they're getting results? So this webinar will share the very different approaches that North Carolina, Michigan, and Arizona are taking in this regard. And they're all at very different levels of development as well. So it's what they have to share and the approach they're using I think will be very interesting for everybody. And I hope that states and communities will be able to take away some of these examples to use pieces of in their own work. So each state will share the work they're doing. Then we'll take some clarifying questions after each presentation, and then we'll move on to hear from the next state. And there will be time at the end for some overall questions regarding the work across each state. So let's get started. I'm pleased to first introduce Joan Blau. She's a Senior Vice President for the Great Start System Strategy and Evaluation. She's with Michigan's Early Childhood Investment Corporation. So thanks, Joan, so much for being here.
Thank you very much, Jerry. I'm very delighted to have the opportunity to talk about the work that we've had the great fortune to do in Michigan, as you can see from my opening slide, for the last 7 years. And what I'd like to do today really is to start out by talking a little bit about sort of where we've come from and where we are now, and where we believe that we're going with regard to the local work. So as in many states, when we started our systems work, we were very much actually really starting from a place where we had a non-system, where we had many different state-level entities, both public and private, that were interacting with folks on a county level, that were then interacting with additional people on a community level. Very highly categorical. There was limited alignment and coordination, and no shared outcomes or accountability. And we realized very early in our planning process, which actually started about a decade ago in Michigan with the advent of the Federal Early Childhood Comprehensive Systems grant programs, that we wanted to move to a different place. And so we started with some real foundational assumptions that I think are important to keep in mind as you listen to the rest of the presentation. That from the very beginning, we wanted to build a system that served all children. We used a strong results-based process for our strategic planning to create the initial statewide plan, and then we rolled that process out to be used locally. We focused on the very beginning from building high-quality programs, looking also at infrastructure with the idea that that was really what was going to take us to improve child outcomes. We knew we wanted to be statewide, that we would have to phase the funding for local communities because we would not have enough, we didn't have enough in the beginning. We worked very hard to find a balance between things that we wanted to be true across the system and also balance that with local realities, needs, and assets. And that is just a fundamental tension, I think, in local-state partnerships to build systems. We focused on infrastructure development, and I'll be talking about what that infrastructure development meant to us. And then we really began with some fundamental core values which we have carried throughout the years that we have been working around authentic parent leadership and voice, which you'll hear more about, a focus on both public and private investment, as well as an ongoing cycle of continuous improvement and learning. So our system picture really fundamentally, we started with this model where we were looking at building all the elements. So comprehensive to us included the things that you can see on this slide in the points of the star. The results that we started with are really at the edge of the star and talk about families and children, and then the infrastructure pieces are the parts where the star is connected. And 7 years ago when we put forth the work to start working locally, this is what we were using to help explain to people what we wanted the system ultimately to deliver for children and families and how we saw the infrastructure connecting programs. Over the years that we were working with local communities, we came to understand what we were doing was really building kind of a set of interrelated networks. Where we had what are called in Michigan Great Start Collaboratives. That's really our local structure that I'll be talking about and sharing results from. As well as related to each Great Start Collaborative, we have something called a Great Start Parent Coalition that are parent-run and parent-driven, and I'll talk a little bit more about those two later in the presentation. And then we also, at the Early Childhood Investment Corporation, have the opportunity to be responsible for the implementation of our quality rating and improvement system in Michigan called Great Start to Quality. And so we really work with all three of these elements when we are thinking about our early childhood system that functions pretty much at the county and regional level. So I think that's helpful to understand in terms of what we're trying to build towards, these things being both connected to each other and also being well-functioning in and of themselves. So with the Great Start Collaboratives and Parent Coalitions, key things that we are really focused on with that is their mission is really to oversee the development of this local early childhood system of public and private programs, services and supports working together in a community to accomplish better outcomes. That's been the mission for the last 7 years. We're in the process right now of working with the Michigan Department of Education Office of Great Start, which was created in 2011, to really begin to understand what is sort of the 2.0 of the Great Start Collaboratives and Parent Coalitions, and I anticipate that some of this mission will be shifting as we come to understand what needs to happen next to really build systems that are more effective and more equitable in meeting the needs of young children in our state. The core document that people really use to manage their work locally and to lead their systems change is a strategic plan. I just want to briefly touch on that. The strategic plans that are developed have some attributes that I think have been very important. They've all been driven by the same set of data that we work with our Kids Count partner in Michigan to produce. We set out a community-based assessment and engagement process that's been used for the last 7 years that's very strongly about engaging with stakeholders in the community. There's a template for the plan, and I think one of the key things about it is then that plan really drives an annual action agenda for the community. In terms of the funding, which is often of interest, the majority of the funding for the collaboratives actually is school aid education dollars. and that will be about $6.8 million this coming year for fiscal year 14, and we anticipate that some of that funding will be supplemented through another funding source as well. But essentially what you see on the slide are the core things that are funded by the allotment that goes to the Great Start Collaboratives and the parent coalitions. You'll notice that this money doesn't fund programs. The intention and understanding from the beginning has been that program dollars flow down to communities and come to the members, the organizational members of the Great Start Collaboratives. And that it is through that organizational membership and shared organizational planning, that strategic plan, that those program dollars are put into effect. So as we measure in Michigan, what does it take to create systems change? We've been thinking a lot about this for the last 10 years and certainly for the last 7 years as we've worked with these local collaboratives. And basically, we've come to two understandings. One is that we've got to make system components, which I'll show you next, the focus of the work that's happening in local communities. And our evaluation has come to show us that we actually have to target those system components using particular systems change levers. The system components that I'm talking about when I reference, many of you may be familiar with some of these. Julia Kaufman put out a version of these system components in a great paper that she did around evaluating systems in 2007. And then the evaluator that we work with in Michigan, Dr. Penny Foster-Fishman, has added to those, and we are working with this model right now in Michigan through our evaluation. I'm not going to spend really any time talking about these per se, but I think you can understand that it's more than just working on programs. It's also working on relationships that have to do with power, with attitudes and values, mindsets, working on policies, etc. I have included for your future use the definitions that we're using of these system components, and certainly would be happy to contact it after the presentation to be able to talk further with anyone that's interested in talking more about these. What I'd like to do next is just briefly show you our theory of change that we use for our local work. Essentially, this is a community-based system planning. You can see that it begins with the idea that you have to do capacity building, and in our case, it's a capable collaborative and a capable and powerful parent coalition, both of which are required. And then you have to execute on certain change strategies, and these are the levers for systems change that we have identified in Michigan through the evaluation that we've now conducted in 2010 and 2012. And it is through the use of those change strategies that you really start to see systems changes beginning to occur, which you see identified in this community context and the Improve and Expand Early Childhood System, which ultimately we believe we're seeing evidence is going to lead us towards our goal. What I do here in the next slide that I'm going to show you is actually break out these levers for systems change, and you can see that they essentially fall into what we call 5 buckets. And when I move into talking about the evaluation results, which I'm going to go to now, you'll understand what the factors that these levers play for us is essentially that the collaboratives and the parent coalitions that are building the most effective and equitable local systems are using these levers for change in ways that enable them to work on those system components that I showed you and are actually seeing improved system-type outcomes for children. So they're working up, if you think about that theory of change I just showed you, they're working up in those green levels where they're actually seeing more access for families to services, changed policies, improved programming, etc. So let me just briefly move on then to show you the methods that we use for the survey. We've got a great response rate, and because our response rate is so good, and we survey so many people who are involved in the collaboratives and the coalitions, we actually can issue an individualized report for each collaborative and each parent coalition that they can use in helping to do ongoing development for their systems. So in 2012, what we saw was that the Great Start Collaboratives and parent coalitions had significantly strengthened all 8 levers for change, and all of these 8 levers that we initially started with continue to play an important role. You'll remember that I talked about how we funded these collaboratives in phases. One of the things we saw that was very interesting to our evaluator and to us as well is the gap between the phases have definitely diminished significantly between 2010 and 2012, which we're happy to see. And both the collaborative and the parent coalition are important to realizing the change that I'm talking about. In other words, if you take the parent coalition out of the mix, the collaborative alone is not as effective in building equitable and effective local systems as it is when the parent coalition and what the parent coalition does is a part of the story. And you'll remember back to when I said at the beginning how important one of our core values has been around authentic parent leadership and voice, and we really feel that that core value has now been validated twice by our evaluation, showing the importance of that authentic parent leadership and voice to the results that we've actually achieved. This next slide really shows you the amount of intentional systems change by phase, and essentially you can see that the earlier phases that were funded earlier and the phases that we're funding later are really starting to merge, and that timing really matters much less. As compared to 2010, the collaboratives and coalitions are making much more progress, and in every outcome area examined, the collaboratives and coalitions are accomplishing far more in 2012 than they did in 2010. All of the levers for change influenced shifts, except active constituents did not seem to play a role, and we believe that's because we had an additional lever emerge that appears to be stronger, which is that local champions for change. If you think again back to that theory of change, down in that capacity building piece, part of building capacity is getting active constituents, but the real shifts between 2010 and 2012 were actually influenced more by these local champions for change. The levers that played the most important role in growth and all accomplishments were readiness for change, intentional systems change actions, and authentic parent leadership and voice. And now I'm just going to quickly show you a few of our results slides so that you have a sense of what some of the findings are. So if you think back to that theory of change, at the top level, all children ready for school, you can see that we have moved the needle based on the folks who are participating on these coalitions, on the collaborative, on the work groups, and key partners in the community, that because of the efforts of the collaborative and the coalitions, more children are ready for school in communities. On parents' needs are met, you can see that access to service has improved. Services that meet parents' needs have also improved. In looking at a responsive and supportive community context, you can see that we've made significant progress in things like quality system improvements, broad community support, more responsive organizations. Looking at improved and expanded early childhood systems, you can see that we've also made significant progress in things like service coordination, access to services, expanded array of services, and increased investments.
Joan, you've got about 5 minutes left. Okay,
thank you. Again, good progress in building authentic parent leadership and voice. More parents and professionals both saying that that's happening more and more in their communities based on the survey items. And also on making progress on building readiness for change. So we established in 2010 a way of looking at the stages of change and the ability to understand where people were in the change process, and basically compared and contrasted on 5 core accomplishment variables. So what I'd like you to notice about this is the bottom triangles essentially represent where the collaboratives and coalitions were in 2010. And you can see that the highest level we reached in 2010 is about equivalent to our middle group in 2012. And then in 2012, we actually have a whole other group that didn't even exist previously, a group of collaboratives and coalitions that are essentially working at a much higher level than they were in 2012 and creating effective and equitable early childhood systems. So what we essentially think this represents is a movement from what was very much sort of a typical coalition collaborative building effort around mostly engaging your constituency and getting to shared goals and et cetera. And then by 2012, that we really have much more of a movement approach where we've got much more strong parent leadership and voice, and that was at the core of that movement building approach. And we have about 25,000 parents who are involved in a variety of activities at the local level. So what I want to just quickly touch on here is, I think, part of what still remains for us, our work ahead. You can really see here that if you look at access to services and parents' needs are met, those numbers have moved. They're not great. If you look at beliefs about capacity to change, you see that people kind of believe that they have the capacity. But when you look at these numbers related to necessity for change, that's the needle we haven't budged yet. So essentially, we're not doing that great on access to services or meeting parents' needs, and we have a lot of organizations who don't yet see the need for change. So where are we going from here? These are the things we're going to be focusing on for the next couple years before we do the evaluation again, which is authentic leadership and voice, readiness for change, and intentional systems change actions, and growing higher local systems change capacities and skills in things like service coordination to better meet families' needs. And then, of course, this ongoing need to respond to the dynamic nature of the collaboratives and the coalitions. So thank you for the opportunity to share the results, and I'm very happy to answer a few quick questions, and I know at the end, however you want to do that, Jerry.
All right, great. Kim, while you're working on sharing your desktop, I'm going to ask a couple of questions, if that's all right. So if you want to start doing what you have to do technically, then I'll introduce you right after that.
Okay.
So Joan, we've had a couple of questions about how you're connecting the system building efforts and the results you've gotten to child outcomes.
So what I would say is that this system building effort was connected initially, as I said, to those results. However, in the last 2 years, with the creation of the Office of Great Start, our governor has established a set of prenatal to age 8 outcomes for children. And we're in the process, part of why I was saying that we're going to see some change going forward is that we're in the process of moving towards adopting those P8 outcomes, and that the collaboratives work will all orient around those outcomes. And there's a lot of work that's happening at the state level to really orient across departments so that as local programs are being operated, they're being operated in alignment with those outcomes. So the collaboratives themselves have not had programmatic dollars to impact child outcomes directly. So they've really been working around these coordination pieces and alignment pieces and leveraging new money and figuring out how things can work together better. And I think we're very much poised to begin to be able to do a much better job of linking. But as also is true, as in many states, I mean, we don't have yet an early childhood data system at the level at which we need it to be able to show those. And we're about a year away from launching a full-scale, for example, kindergarten entry status assessment, and in the process of beginning to think about being able to bring people together to work on an early childhood data system. So we're on the path, but we're certainly not where we wish we were. So
the work never ends. One more question. Several people were impressed by the response rate you had from your surveys. How would you account for why you had such a great response rate? And was it the same people filling them out over and over again, or did you?
No, everybody has a unique link that they use. We work with Michigan State University, Dr. Penny Foster Fishman and her team there. And I have to say, they're amazing. We also work very closely with each of the collaboratives and the coalitions around how important the response rate is. And I think part of it is there's very high utility in the reports that are produced. They've really helped people make substantial progress. And so I think they understand. I mean, my theory is they understand the benefit to them of having the highest possible response rate because they've got the best possible way of understanding what's really happening in their community when that's true. So be happy to share, if people, again, want to follow up, we could share what one of these reports looks like so you can see kind of the utility factor there. So.
Great, thanks. And one more question. How did you measure readiness for change, and what role have the local school boards played?
Local school boards are not connected with the collaborative per se. The collaboratives are convened by what are called intermediate school districts in Michigan. Some people know them as education service agencies. And then the membership is local community leaders from the public and private sector. So a school board member could be a member of the collaborative, but they're not connected at this point. I could imagine, given the Office of Great Start's leadership and how we're looking at moving forward to connect across the P8 outcomes, I could imagine that will happen going forward. So the way that readiness for change is defined in this evaluation is that there's a perceived need that change is needed, that change is desirable, and that change is feasible. And then there's a number of measures that are used inside the evaluation itself to look at those attributes of readiness for change.
Great, thanks so much. A few more questions that have come up, but we're going to hold those to the end so we can move on to our next presenter now. So I'm pleased at this time to introduce Kim McCombs-Thornton. She's Director of Quality Assurance and Evaluation for North Carolina's Smart Start Initiative and works for the North Carolina Partnership for Children. So thanks for being with us today, Kim.
Thank you, Jerry. So Smart Start is a young adult now. We are celebrating our 20th anniversary. So Michigan is 7, Smart Start's now 20, Arizona is even younger. So our mission is to advance a high-quality, comprehensive, accountable system of care and education for every child beginning with a healthy birth. And as many of the states out there, we're really focused on a comprehensive whole child readiness for learning, particularly at kindergarten entry, but certainly focusing beyond that as well. So Smart Start is a public-private partnership, and what that means is that we have a large amount of state funding, and that runs through the North Carolina Partnership for Children, where I work, NCPC for short, and we use a needs assessment or some sort of needs allocation-based annual process to ferret that money out to each of the 100 counties represented through 76 local Smart Start partnerships. Now what's interesting is that NCPC is a nonprofit, as are each of the 76 local partnerships. So we're all independent nonprofits, and so that's where the public-private partnership comes into play. So in addition to the state funding, each of the partnerships also writes grants and does individual fundraising as well. This model has some unique characteristics to it. So while each of the partnerships are individual, independent nonprofits, they have a lot of autonomy in determining how to spend the Smart Start funding at the local level to be flexible to meet local needs. Certainly within certain parameters provided by the state legislature. So as you can imagine, this model, this flexible model with a lot of local autonomy, creates both challenges and opportunities for evaluation for Smart Start. So I like to think of Smart Start evaluation as a patchwork quilt. And so there's a lot of pieces, and hopefully over time, the quilt is getting larger and the holes are getting filled in. So our local partnerships, we've trained them over the years in logic models, and so they do logic models for their activities, and they also collect and analyze their own programmatic data for program management purposes. At the state level, we then take those data from local partnerships, summarize that. We also have some third-party evaluation studies. Some of them are contracts for certain Smart Start activities each year. And then there's also been some independent researchers, most recently from Duke University, who have taken upon themselves to do some Smart Start evaluation work. And then the actual cornerstone of our work at the state level for evaluation, which then also is used at the local level, is what we call PBIS, or Performance-Based Incentive System. And that's the piece that I'm going to talk about this afternoon. So Performance-Based Incentive System, or PBIS, these are annual reports that we at NCPC produce for both all the local partnerships and an aggregate report for the state level. Now, what's important to know is that these are community-level indicators, essentially county-level indicators, okay? And these indicators, or these measures that are used in the report, are those that the Smart Start system has selected to represent what the Smart Start partnerships should be held accountable for. So why go through all these efforts? Well, first of all, we are required by NC legislation to ensure programmatic integrity and to assess the local partnerships. In the late 1990s, a report was done showing that Smart Start really needed to enhance the work around accountability. So we moved toward doing these county-level indicators. So as you can imagine, it's really important to figure out which measures needed to be included as our county-level indicators, because as I mentioned, these are items that the Smart Start partnerships are held accountable for. Well, how did we go about doing this? We started this over 10 years ago, and pretty involved process. In doing so, we brought in a variety of experts in terms of content from local universities, and also representatives from the local partnerships and local partnership and NCPC board to meet together in these content areas that are related to the Smart Start core services. Now, these Smart Start core services are early care and education, particularly focused on quality and workforce development, family support, and health. So as these panels got together in their content areas and started selecting indicators, there were two main criteria that drove their decision-making process. The first is that, again, these indicators needed to reflect Smart Start core services, and also that they needed to come from some sort of standardized statewide data source, and that would enable us to produce consistent reports for all 100 counties and hold everybody to the same standard. Okay, I want to give you a sense of the kind of indicators that are in our PBIS report. Again, these are broken up by our core services. So early care and education quality, really the backbone of our PBIS, focuses on the average star rating of child placements. And what I'm showing you here are the different data sources that we pull from to produce that indicator. Now, unfortunately, it's not just as simple as getting the data from our Division of Child Development and Early Education at the state and just putting it in a report. What we learned quickly over the years is that that is a fabulous, comprehensive data source, but there are some kids who are being served who are not in there because they are in centers and facilities that are not part of our licensing system. So for instance, some Head Start centers, or some Title I, or even some NC Pre-K at one time. So part of the message here is that if you go this route, that things may not be as simple as they seem, that there's a lot of work that goes on behind the scenes. So in addition to the average star rating of child placements, we also look at percent of children in 4- and 5-star care. And so in order to produce these two calculations, one thing that we really have working in our advantage in North Carolina is that our child care license is rated. And so we have a 1- to 5-star system, and we consider 4- and 5-star to be high-quality care. Now, we take those two indicators, and then we also look at those for subgroups of children. We look at those for children who receive child care subsidy, and we also look at those for children who have some sort of special needs designation. And then lastly, for quality, we look at percent of children in nationally accredited programs. So child care education and supply. We have three main indicators here. The first is the ratio of child care spaces to children in working families to kind of get a sense of capacity. Percent of children receiving subsidy who are enrolled in regulated care. And then lastly, percent of low-income children enrolled in early care and education programs. I just want to point out, for this indicator alone, we go to 5 different data sources. So again, the message is there's a lot of underlying work to kind of really drill down and to develop the indicators as comprehensively as possible. Fortunately, it gets easier in terms of the calculations. So when we move to early care and education, staff education, in North Carolina, we focus on education points. In other states, you may have a very similar system. So essentially, you earn a certain number of education points that reflects your certificate or your degree and the amount of coursework that you have. All these data come from our Division of Child Development and Early Education, and we produce our calculations straight from those. And then in the health arena, many of you know there are a wide variety of really good data sources out there for health indicators, and we try to tap into those. So the first one that we look at is percent of children in early intervention services broken out by age. Percent of children enrolled in Medicaid who receive a well child visit at least once during the year. Infant mortality rate. Percent of children ages 2 to 4 who are obese. And then percent of children with elevated blood lead level. So all these indicators, again, we get from state agencies, or in some cases, as you saw, federal data. We calculate those for each of the 100 counties, and then we also aggregate the results for the state. Okay. Now, you'll notice that I didn't mention indicators for all of the Smart Start core services, for instance, family support. We have really struggled over the years to find good community-level indicators that represent the kind of work that Smart Start does in family support. We have done some work on collecting our own data there, but community-level indicators, we've really not found a good one. And I would love to hear from folks later on if you've had some success with that. We've also not been able to find on a consistent annual basis data on the child care workforce and children's oral health most recently. Okay, so Jerry asked me to share some of the findings that we have so far. Well, the good news is that since we have been around for 20 years, enough time has passed to really see some trends. So for instance, if we look at average star rating of child placements, you'll notice we started collecting these data in 2001, 2002. And when we aggregate at the state level, you'll see at that point the average star rating of child placements was a 2.76. 10 years later, we're just over an average of 4. So you can see the trend is certainly in the right direction. The other thing I want to point out here is you'll notice this red line that says minimum standard. We are required by the state legislature to set performance standards for each of the local partnerships, and we do that through our PBIS. So with each indicator in PBIS, there is a minimum performance standard and a high performing standard. The other thing I want to point out is that the data that you are looking at are North Carolina state data. I know this is a webinar about local evaluation. I didn't really want to just point out just one county, but I do want to let you know that the data that you see here, we make available to all of our partnerships for each of the counties in their partnership. So these kind of data are available to them to plan and to understand changes and trends in their own counties. So coupled with average star rating of child placements, we again look at percent of children in 4- and 5-star care. And you'll notice the trends here are in the same direction. Over 10 years ago when we started, only a third of the kids were in what we consider to be high quality care. Most recently, up to 70% of children are in 4- and 5-star care. As you can imagine, we're really happy to see that. The other thing I want to point out is that you'll see here the minimum standard. Again, we have exceeded that now. But what I haven't pointed out is what is high performing. And the way that these two indicators work together is that essentially if you meet minimum for the average star rating of placements and you meet minimum for percent of children in 4 and 5 star care, then we consider that county to be high performing. Okay, so the other thing you might say is, well, North Carolina, great, and maybe it's time to start raising the standards because clearly, you are exceeding that minimum standard. And that would be something that we have certainly started to talk about. The other thing, too, is that we are looking at our QRIS through the Race to the Top Early Learning Challenge. And so what may happen is that our measure actually changes. As QRS changes and tightens, we will be interesting to see how that affects the trends that we see over time. The other thing that we've done is started to, most recently, just the past year, look at some of our PBIS indicators for subgroups. We call this our disaggregated analysis. So, for instance, you'll see here percent of children in 4 and 5 star care broken out by age. The story may very well be what a lot of folks would expect. The older children are in a higher quality care than the infants and toddlers. Another one I'll share with you has to do with teacher education. And our indicator really is looking at percent of children with the lead teacher having 5 or more education points. And you can see here, one of the things you'll notice is that this indicator goes back to 2006-2007. And at that point, less than half of the kids had a teacher with 5 or more education points. And in just the course of 6 or 7, I guess 6 years here, we are now over the minimum standard. However, when we disaggregate that out by age, you'll notice that infants and toddlers are actually below minimum standards. So there's clearly work to be done. And one of the ways that, that these data are being used at the local level that I think is really exciting, through Race to the Top, we have what's called a Leaders Collaborative. And what this does is it pulls together cohorts of executive directors of the Smart Start local partnerships, and they are charged over a period of 8 months to really looking at their community level data. A lot of it is this disaggregated data by these subgroups that I'm showing you, and selecting an indicator that really moves them and that shows some disparity for a group of children. And then they're charged with going back to their communities, pulling together key folks to help brainstorm about this, figure out how to address it, develop a plan, develop shared agreements. And so these data are really being used to affect work on the ground. And so I'm interested to see how these trends change over time in the counties who are selecting this indicator in particular, because this is one that's really resonating for a lot of our executive directors. Okay, so I do want to give you a snapshot of what we look like at the county level in terms of meeting these standards. Now, you may recall that I shared a fair number of PBIS indicators. We really focus on 5 that reflect some of our main core services. So ECE Quality, you'll notice, and subsidy quality, we are doing very well in. I tell you, with 100 counties, it makes the statistics really easy. So all 100 counties just this year have met the high-performing standard for ECE Quality, and subsidy is close behind. Just want to let you know that the standard that we set for subsidy is actually higher than the standard for overall child placements, and that's why the subsidy is a little bit lower than the ECE Quality.
And Kim, you've got about 5 minutes left.
Thank you, Jerry. So these trends actually mirror very closely how Smart Start funding has been distributed over time. So Smart Start partnerships are required to spend 70% of their funding on early care and education. Okay, so that is, we certainly see that in these results, or they're parallel the results here. Teacher education is an interesting one here because you'll notice that's the one big indicator that the most counties are still below minimum on. So 19 were below minimum this past year. That's actually an improvement because the year before that, 28 were below minimum. So as I mentioned, this is one that a lot of the partnerships are really starting to target and learn from each other about what strategies might be working. And then at the bottom, you'll notice our health indicators. And certainly, people are meeting standards, but we're really not at that high-performing level yet. Only 6% of Smart Start funding goes toward health, so this has been one that folks have had a harder time being able to see some big movements in. Okay, so advantages of doing community level indicators. Well, first of all, it gives us some sort of consistent measurement tool, and it allows us to have some statewide results to share that despite, I guess, having this system that is so decentralized where the partnerships are really, a lot of them are doing a lot of creative things within their own counties. The other thing is that it does allow us to set some standards, and it provides some planning information both at the state level and at the local level. Limitations are, for the researchers out there, you can certainly say, well, hey, the design is not strong enough to know if these results we're seeing are actually due to Smart Start or not. And that's definitely true. It's certainly true when we look at community impact research in general. But as I mentioned, since so much Smart Start funding has gone into particularly early care and education over the years, we can certainly make a case that Smart Start had something to do with these trends that we're seeing. Another limitation, as we already saw, is we don't have data on all the indicators that we're interested in. So we can't control how they're measured and how frequently they might be measured. One good news, though, is just as Joan mentioned in Michigan, in North Carolina, we are fortunately able to finally start embarking on having a consistent kindergarten readiness tool. So hopefully in a few years, we'll be able to add kindergarten entrance assessment data to our PBIS. PBIS can also get fairly technical. You saw all those data sources that we talked about. It can be easy to get lost in all that as you're describing to local partnerships what it is we're actually doing with the data. And it can also have a report card feel. When you're a good student, you don't mind getting a report card. It looks great. And for those of us who may not be straight A students, it doesn't always feel so good. And so as you can imagine, we certainly get pushback as well on that from that respect. So if you are thinking about doing some community level indicators, one of the things that we have learned that is very important to have good relationships with those state level partners who will be providing you data. For one thing, you'll be asking it for on a fairly frequent basis, and so you'll want to be in their good graces and also to kind of rise to the top of their list of people who they are willing to provide data to. You also need to have confidence in the data sources, and that includes the local partnerships, and in our case, the legislature. And one of the ways that we've been able to do this is, no one knows what's going on in a community better than our local partnerships. And so when they get their PBIS report, they might look at that and go, oh, no, something doesn't look right. And so they'll get back to us. We'll start digging into the data to find out what's going on, and then we'll contact our state partner about that. And there have been cases where one of our local partners has uncovered some issues in data collection that, feeding it back through us and to the state partner, has been able to make corrections in terms of the data collection procedures. And so that really helps build confidence in the data as well as quality assurance. We've also learned that if you raise standards, people might not like it, but they will respond over time. But it does take time. And then lastly, this is certainly a continual process. We've been doing PBIS for 10 years now. We've now moved to the disaggregated data. We're moving to having an interactive website so partnerships can log on and graph their data and see trends over time. And through Race to the Top Early Learning Challenge, we're actually starting to develop some common outcomes for the partnerships for the data that they would actually collect themselves. So PBIS are the county level secondary data indicators. So now we're able to move to having some common program indicators. So I will leave it at that. And Jerry, I can't see the questions coming into my screen, so if there are any, please share them.
Most of them I was able to respond to in writing, so we were able to cover those. So I did have one question that I couldn't answer. Can you remind us what counts as high performing versus meeting standards with the EI data point?
Absolutely. So for the EI data point. So EI meaning early intervention, I would imagine that folks are looking at. So for, I'm looking it up right now. I don't want to tell you wrong. So minimum standard is that both children aged 0 to 2 and children aged 3 to 5, that at least 3% of each of those groups are in early intervention services. High performing would be that at least 5% of each of those age groups are in early intervention services.
Great, thank you. Well, thanks, Kim, so much. There will be more questions that I'll ask you as well at the end of this, but I want to go ahead and move on to Arizona so we can hear the work that they're doing. And from Arizona, we've got two people who will be presenting today. Karen Woodhouse, she's Chief Program Officer for Arizona's First Things First initiative, and Rupa Iyer, who is Senior Director for Research and Evaluation at the First Things First initiative. So welcome to today's webinar. Thank you. And Karen and Rupa, just make sure you're unmuted.
I wasn't unmuted. I apologize.
That's what I thought.
Hi, everyone. Good morning. It's still morning in Arizona. My name's Karen Woodhouse, and I'm going to get us started, and then Rupa will provide you with some additional information here. Our purpose is to give you just a glimpse into our research and evaluation plan, which was developed last fall. And it was based on recommendations that were provided to us by a national panel we convened. And Rupa will say a little bit more about that. I'm going to begin with just a brief overview of First Things First. And then we'll talk about our plan and the elements contained in that plan that help us measure progress toward results at both our local and state level. There we go. All right. First Things First is a state government agency, and our official agency name is the Early Childhood Development and Health Board, in case you ever hear that about Arizona. Our mission is to increase the quality of and access to the early childhood development and health system that ensures every child entering school is healthy and ready to succeed. We are really careful about saying we are not the early childhood system in Arizona, but we are definitely a strong partner with many other strong partners who have been doing this work for quite a while. And we are all trying to develop and enhance the existing system. First Things First was created through a voter initiative in November of 2006. And we really didn't get off and running, I would say, until we created our regional partnership councils, our local councils, until we created them in 2009, and they began to actually invest in work in their community in 2010. The First Things First initiative designated three primary things. One is a governance structure that includes a state board and local community regional partnership councils. And we currently have 31 local councils. 10 of them are actually councils in tribal communities. And the second thing it created is a funded delivery system for programs and services. And this is the grantees and the partners that are working in local communities, and some of them working across the state, that are the way that we deliver what's funded through First Things First. And then this initiative also created a dedicated funding stream through an additional tax on tobacco products. And we currently have tobacco tax revenues just under $130 million a year that comes solely for the purposes of early childhood development and health. Our model is a little bit different than some other early childhood system models in other states because our state board has primary fiduciary and decision-making authority. So we are a little bit different than some of the states you've heard about, or some of the work in Michigan and North Carolina that you've heard about today. But our partnership councils do have decision-making authority, and they forward their recommendations up to the board for final approval. Our initiative was definitely passed because of the local community component of First Things First. Without the idea that local communities actually get to make decisions about what's invested in for kids and families in their area, we wouldn't be here today. So this is where the majority of First Things First funding is directed. And like most early childhood systems in other states, we try to address issues in local communities, and also show results both at that level as well as the statewide level. Our approach is to hold local and state programming accountable for producing results for the kids that are served in that program. And we also hold ourselves and our work as a partner in the system accountable to impact statewide population data. We have 6 goal areas that were determined by the statute that was passed by the initiative in 2006. And this is what we focus on through both our local and statewide efforts. Throughout the 6 goal areas, we have over 50 different strategies that have been funded at both the state and local level. There has been some consolidation of strategies through, I'd say, maybe the last 2 years, as we found, some things fit together more nicely than needed to be separate, or we found that one strategy just wasn't as effective as we had hoped, or it was difficult to have somebody deliver that particular strategy. But we still have over 50 different strategies. But there are several strategies that do have a much larger investment collectively across the state, be it at many different community levels, or we've determined it's a state-level program and the regional councils have also invested in it. Among those would be our quality improvement system called Quality First, our home visiting programs, scholarships for low-income families so they can access high-quality early learning programs for children, and then we also, one of the larger programs is scholarship and wage enhancements for the early childhood professional workforce. All of the information on our strategies is found in our First Things First Strategy Toolkit on our webpage, and I've provided a link at the bottom of this slide. Each strategy has an evidence-informed standard of practice developed for each strategy. Other elements in the toolkit are the data requirements for grantees that are delivering a program. We also include cost information if we have that available. And the toolkit's always improving. We add new information, new evidence. We update the standards of practice, update cost information, data requirements as we see fit or as it's appropriate. And just a quick note about our tobacco tax funding. You can see from the graphic that if you add up the 81% of every dollar and the 9% of every dollar, that makes up 90% of our money. So 90 cents of every dollar that we take in tobacco tax goes for programming. And then 10 cents for every dollar, or 10% of what we take in as revenue is allowable for administrative costs. Partnership councils are allocated funds by the board based on the number of children birth through age 5 that live in their region, and they receive additional weighted funds for children that are below the poverty level. So we operate through just a flat-out formula funding to get money allocated to the regional councils. 25% of the funds that are brought in for program are designated as discretionary, and the board can determine how those funds might be used. But at this point, they have determined that they just wanted to formula allocate the discretionary money out to regional councils as well. All of the funding for our research and evaluation and data collection efforts is funded using these program funds from both the regional and the state level. We don't use admin for evaluation. And so our approach for research and evaluation is reflected in the evaluation plan, and this graphic just gives you a little bit of an idea of what that looks like. We collect data and do studies at several different levels to check that we're making progress toward outcomes. So the idea is that at the bottom of this inverted pyramid with implementation data, grantees report on mainly information related to contract compliance and expenditures. Are they doing what they propose to do, and are they in alignment with the standard of practice? We do desk reviews, and we also just launched the initial phase of a quality assurance system that is both targeted quality assurance and responsive on-site assessment. So if programs and services are being implemented with quality, we should see program outcomes, and that can be confirmed through the next part of the inverted pyramid, which looks through program or strategy-specific studies, including data collection, surveys, evaluation, research, to find out how programs or combination of programs are working together to impact target populations. So we're asking, does the program lead to outcomes for the kids that are being served through that program? Do we have programs going to scale to get larger impact outcomes? And if so, that should provide support for system outcomes, child-level outcomes that would be reflected in changes in either discrete child-level outcomes or population data. And that's at the very top of the pyramid. And at this level, we're really talking about child-level outcomes as well as 10 school readiness indicators that we have developed to use as markers for our progress. And so I'm going to now turn it over to Rupa. She's going to share a little bit more about those indicators and then highlight some other information in our evaluation plan.
Hello everyone, this is Rupa. I know that we have about 7 minutes and a lot of slides to go through. So Jerry, do keep me on track. So today I'll be reviewing the highlights from the research and evaluation plan. However, before we get to that, I want to quickly review our school readiness indicators. That's a measure of progress towards the system outcome that FTF has set. We had Early Childhood Task Force meet. We had stakeholders and state agency partners who were at the table who selected these indicators, and FTF board adopted them to measure them as our statewide and regional outcome. So we have 10 school readiness indicators, 3 on health, 1 on family support and literacy, and 6 related to child development and early learning. And you can see a link in the bottom of the page where you can see what state has set as the benchmark for our school readiness indicators towards state fiscal year 2020. And currently our regions are also working on the same. They are setting the regional benchmark, and each region out of our 31 Regional Partnership Council will select and prioritize 3 of the indicators out of these 10 standard indicators. And we are using data from FTF as well as our state agency partners such as Department of Health, Arizona Department of Education, Indian Health Services data towards this goal. And there are a couple of school indicators that currently we are still selecting our data source, and as we get them, we'll be moving forward on the benchmarking related to that. And if you look into the data planning cycle, so this just tells us what are the different pieces of data we have and how is it structured towards planning. So we have a statutory requirement to conduct statewide and regional needs and assets every 2 years. So we look to see where is our strength, where are the weaknesses within our community, so the council can use that information towards strategic planning and decide where the fund needs to go. This also guides FTF in deciding what kind of strategy needs to be developed to be implemented across the state. And we make evidence-based practice to decide the strategies and also develop standards of practice. So this is implemented in a standardized way across the state, no matter which regional council is choosing the strategy. And all this data comes in, and along with that, we also have regional studies and population level data, census data that we use towards the decision making, and then we also have state partner agency data that we receive as a part of this needs and assets that all goes into helping FTF make the decision. And as we build a system, it is critical to look where the gaps are based on what data tells us, so we have concentrated efforts so that we can fill these gaps. So when we look at the evaluation plan, first things first strives for complete transparency and hold itself and its collaborators accountable for achieving intended outcomes for children. As a part of this, FTF board requested for us to review closely our research and evaluation approach. As a result, in January 2012, FTF Early Childhood Research and Evaluation National Panel was put together, comprising of 12 nationally recognized experts. We have given you a link at the bottom of this page that gives you the details on the national panel and who were part of our national panel. And as the national panel convened, they provided recommendations to the First Thing Forward to develop a comprehensive statewide plan that can be used and for the next 5 years. And this plan is supposed to give amount and quality and utility of information that helps us to make the right decisions for Arizona's FTF's mission and vision. And one of the key things we want is a relentless focus on implementation that came out of the recommendation. So to look what services we need, what kind of data do we need to make sure that this implementation is happening in the way we want to do, what quality assurance needs to be put in place, and also as a part of that, tightening our standards of practice. FTF data reporting,
Hey, Rupa, you still got about 10 minutes left, so you don't need to speed through. I'm worrying that you're not
because I set a clock for myself, and that shows me 3 minutes.
I gave everybody 20 minutes, so you're fine.
Oh, thank you so much. You know I am a data analyst, so I do not want to go over my time. So, all right. So as we had this relentless focus of implementation, it's key that we get all this data that needs to come into us. So as a part of data requirement, we have around 300 plus contracts that First Things First has that is given all over the state through regional partnership councils as well as statewide funding. And our grantees submit data quarterly on the service delivery to us through a web-based system that we have called Partner Grant Management System, alias PGMS. And we also have data reporting that comes to us, not through web-based, depending upon a grantee's capabilities. They have already strong database like some other state partner agency or even private grantees who could do a file transfer protocol, meaning they directly transfer their database data to our data warehouse through a back-end process so we can still have the data towards performance monitoring. And then in addition to this, they also have a program narrative, which is a quarterly Word document they upload talking about the challenges and the successes that the grantees are facing as they are implementing the strategies across each regional partnership council. So not only our grantees that are selected by our regional council submit this data to us, but also statewide contracts that FTF directly monitors also submit the data into our system. And then we also have financial reporting that aligns with our service data and our studies data that comes into us quarterly, showing based on the award what kind of expenditure are happening, and then we monitor data and finance to see for the amount of where the data should be, is the amount of money spent proportionate, and if there are glitches we see, as we see the report, we have a specific targeted quality assurance team that is put in place that look at all of this data submitted, communications, and other documentation to determine area of progress and improvement within a state fiscal year over the years, and we closely inform our councils and board about this information. So as we make renewals for the award decision, this can be used, and also for continuous program planning and program improvement. In addition to this, we also have regionally funded studies or state-funded studies that looks at program impact in a local community that we are funding, and also look at whether the strategy we put in place is working, or is there need to be a bundling of strategies that needs to happen to get the intended outcome that we are looking at. So we have studies that are targeted to do this. And these studies are for the most part contracted out to vendors who work with each regional council or community, and they are capable of working with the local population, and as they work with tribal council, they also follow our tribal consultation policy to make sure that they are addressing the needs of the population. The report from these studies comes back to us, and then the data also is owned by First Things First. So then again, these reports go to our councils and board as we make decisions, and these help inform what strategies and program may or may not work in a community and what lessons can be applied statewide. So as we have this data, one of the key things that the national panel recommended is to improve our current data infrastructure to make it an integrated data system or a federated database where we not only have the FTF collected service data and the studies data, but then we also consider working with our partner agencies to collaborate and to share data. So there is a depository of data. The discussion are still happening as to what we house and what will be housed in other state agencies, but definitely the intent is to share the data across the Arizona key stakeholders and state agency partners. So there is no redundancy or nobody is reinventing the wheel. Data is actually collected and used, and the expertise of different state agencies are brought together so we can have a statewide data source. So again, there are challenges and successes to these efforts. We also have census data that we house and we share with our vendors and grantee agency as they put together data. The success is that when we especially work with our key data partners, we have had great relationships and everyone is at the table from the get-go, so we can talk about where are the shared motivation towards this goal, where are the gaps that we need to inform the partners or work with the partners to educate ourselves in the process too. If they've already tried and tested something, we learn from that. The challenge is that some of our state agency partners have legacy data systems, so there's a compatibility of a true working data file that we can pull, and is our system and their system compatible? So we are putting in a lot of efforts to not only work with our program partners at these different data agencies or state agencies, but we are also working with the IT and the evaluation divisions in these other agencies so we can have a shared effort. And FTF's IT division and evaluation divisions are working very closely in developing this integrated data system so that all system pieces are put in place and the infrastructure is something that is staffed enough. And towards this, we have set aside as a part of national panel $3.5 million per year towards building this data system. So overall around $17.5 million for this 5-year plan. And this goes into not only the technical system development, but also staffing and data sharing expenses.
And Rupa, you got about 5 minutes left.
Great. So as we have data for decision making, we have to make sure that we have outcomes, we have indicators, we have these national panels, and the strategies that we already have in place that needs to come together. So the key that we understand towards decision making is that we help our decision makers to interpret the data. So we have specifically worked on display of data not only through reports, but we are also working on interactive data display. So a council can have data available to them. So when they go and click and look at their regional council, they can find their data, and they have technical assistance and capacity building to interpret and use the data. As a part of this interactive display, we are thinking about some mapping tools so people can go into their particular community, the regional council, see what services are available, and also look at the update on data from FTF database. And then we have ongoing concentrated training not only for our council members, but also for our staff internally so they can go out and support to make our stakeholders understand what this data means. So when we work with our regional councils, we ensure that the data evaluation and research meet the needs of the councils, and we integrate the ongoing needs and assets into our decision making, as I said before, and we also work to get feedback from our regional councils to make sure they are informing this ongoing plans too, so that we gain insights from the communities. And again, as said before, we work closely to make sure when we work with tribal partnership councils that we are following the data ownership rules, the tribal approvals, and the consultation policies. We have multiple studies that is there as part of the evaluation plan. I have not listed everything, but I have put some highlights here. You will be able to go into the link we provided earlier for the national plan, and you'll be able to get details on this. And some studies are one-time studies just to understand what is the state on child care demand, what is the state on workforce. But then we have ongoing recurring studies that is a statutory requirement like needs and assets, children's budget, looking at family community survey that looks at parent knowledge and competency across the state. One study that I would particularly like to highlight is our Quality First, which is Arizona's voluntary quality improvement and rating system. Improvement system comes first, thus QIRS, not QRIS. And we have a 5-star rating scale, including environmental rating scale, class, and then point scale that we developed. And then different components of coaching, assessment, incentive, scholarships, and technical assistance related to mental health, child care, and inclusion goes into this. As a part of the current 5-year plan, the key thing that came out was conducting a multi-phase study that looks at and evaluate the design and implementation of Quality First. Is the rating scale that we are using really valid? Are the program data and the data that we are collecting through a special Quality First data system that we have developed above and beyond our web-based system? Have we put everything in place? Is the logic model we put in place accurate? Is the model design implemented with fidelity? Are all the components working together? These are the pieces that will be looked through our Quality First validation study. We are in the process of developing the RFP. It will be going out later out this year, and the next 3 years we'll be collecting this data to inform further improvement in our quality improvement rating system. So as we are implementing this evaluation plan, we know that we will have success and challenges. However, the key thing will be for us to continue to move forward by remaining focused on our vision and remembering that it takes not only FTF but our caregivers, our government partners, community organizations, and policymakers working together to ensure that our system gives every child in Arizona an opportunity to maximize their potential. I will turn this around to Karen to go over some of the final details towards finishing our presentation.
Just a quick note, we too are one of the states working on a kindergarten readiness assessment. We were not funded through the Race to the Top competition, but fortunately, because we developed a plan related to this assessment, we had a lot of partners who were engaged in this discussion and wanted to continue that discussion beyond the grant application process. So we're continuing to work. You can see the purposes of our intent with our assessment. We're working very, very heavily in partnership with the Arizona Department of Education. And we also have a private philanthropy that's invested or committed to investing money to help us with the initial infrastructure and development costs. And we're also part of a group of states that are talking with North Carolina at this point related to a federal grant opportunity that we're hoping to hear about soon, a consortium of states developing a kindergarten entry assessment. So our plans will continue in that regard. And then finally, I just want to mention our evaluation budget. We have approximately $9 million annually for both the development of our data system, our studies, data collection, anything related to our evaluation and research plan. And this is about 7% of our program monies that we have annually budgeted. So all of our money comes from First Things First funding in statewide funding, regional funds, and we also draw down some of our sustainability funds. We do look for opportunities for federal grants, collaborations with other state agencies and philanthropic agencies, obviously like I talked about with the kindergarten entry assessment, to supplement that if we have an opportunity to do so. And then finally, just going back, we tried to give you just a piece of each of these elements of our data and planning cycle. And you can read more by hitting the link that talks about the national panel recommendations for our research and evaluation plan. And you can contact Rupa and I if you have any additional questions. We'd be more than happy to talk with you. Thank you.
Thanks so much, Karen and Rupa. And I've got some questions for you guys and also some questions for our other presenters as well. So I'll start with you while I've got you. First question, is the Arizona ECE data system in a coordinated effort with the state longitudinal data system?
Yes, definitely. We're in discussions right now about how we make sure that all of that is aligned. And as Rupa explained, we intend to have a federated data system so that it's not that all the data is going to one place and being housed. It's a system that will allow various agencies and partners to access data from the sources that are available. So we are very much working with the Arizona Department of Education and their work on the longitudinal data system.
Great, thank you. Joan, a question that came in for you. What do you see as the possible system change action that you reflected in one of your last slides on your presentation?
Well, that has to do with being one of our levers for change, which if you think about that wheel I showed you, showed the levers, and it's intentional systems change actions. So it's pieces like improving local service system operations, like workforce development, program quality, program access, increasing program responsiveness to family needs and aspirations. It's things like building public will around, for example, people could be working on social marketing, connecting with the media, mobilizing grassroots, investing in parent leadership development, things like aligning local policies and practices, conducting a systems scan, using those system components that I showed you in the wheel form and then gave you definitions for, and actually understanding where you stand on those various pieces, and then intentionally targeting systems change. So those are what are defined through the evaluation as intentional systems change actions. And the more of those that the collaboratives are doing, the more effectively they're actually realizing outcomes to improve the system's responsiveness and ability to meet the needs of children and get kids ready for school.
Great, thank you. Kim in North Carolina, how are you connecting the PBIS indicators to child outcomes? Is that something that comes up with the legislature that they want to know that connection, or are they happy with what you're able to show in terms of your current progress?
There's a lot of pieces to that question. Actually, some of the PBIS indicators are child-level outcomes. The quality indicators are child-level outcomes, as well as the obesity and early intervention, receipt of services. In terms of linking them to kindergarten readiness per se, as I mentioned, we're not able to do that yet. But our plan is, we are fortunate to have a Race to the Top grant, and the state has a very significant data project embedded in that, which will be ultimately linking data sources from a wide variety of state-level databases, including Smart Start data, that ultimately we will be able to look at longitudinally what is happening for the child and within the child's community, and then looking at how that affects kindergarten entrance, as well as third grade reading, graduation rates, and so on. And the legislature actually has been very supportive of building that system even before we receive Race to the Top. So I guess the best thing to say is that the groundwork is being laid and we're being patient.
Thank you. For all three of you, has the Early Childhood Comprehensive Systems Grant Program contributed to any of the work that you're doing around measuring local results and measuring your work at the state level?
This is Joan. I can say that I've been Michigan's Early Childhood Comprehensive Systems Coordinator since the grant was initially funded in Michigan. And so the ECCS grant has been a fundamental part of all the work that we've done through the support of my role and a few other small kinds of investments. We really leveraged that money to achieve many things. And we built the local system as an integral part of our overall system building in Michigan.
This is Karen in Arizona, and I would echo how Joan has framed their approach using the ECCS grant. We haven't necessarily designated the grant to fund the data collection or evaluation piece of our system work, but it has been critically important, especially this year, in the development of our professional development system. And then our proposal that's being evaluated right now for fiscal 14, we are focusing on the intervening early piece of our system and developmental screening and some things related to that. So obviously data that flows out of those two pieces of the system would be very critical for us to monitor progress, not only in the development and implementation, but also then getting results for kids.
This is Kim, and in North Carolina, the work that we've talked about today really has been independent through the Smart Start system over a pretty long period of time. And then really I would say it's Race to the Top that has really been moving us forward, and hopefully moving us forward in the next several years in our data work. Jerry, do you have more to add in terms of North Carolina?
No, I mean, the lead on the ECCS grant was always a great collaborator with Smart Start and the North Carolina Partnership for Children, but all the work around PBIS specifically was done separately from that. All right, we have another question related to all of the data that you're gathering. So someone wonders if there's if you have examples of data sharing policies across entities and agencies that maybe you've developed and would be willing to share. And also, have you been able to, how much luck have you had in getting the federal Head Start data?
So this is Rupa from Arizona. So the current data sharing policy, so we worked from our FTF data sharing policy, we worked very closely with our legal counsel to decide what pieces of data that we have that we can share and with other state agency partners and stakeholders following the HIPAA FERPA regulation and the GIDA regulations, that is the IT regulation, and also went through the security systems to make sure that we had all the clearance to not only house the data, and when we do share the data, what pieces can we share at what level. At this point, FTF does not collect or house a lot of client-level data, but that is something that as a part of this integrated database build we are planning to do. But when we work with our state agency partners, we kind of work with them to create that shared MOU or a shared data policy, exchange policy, so that we follow their state agency rules around what could they share, and are there pieces that we can share with them. So we have de-identified information that comes with some kind of encryption so that there is no client-level data coming into our database, but we still get the pieces that we need to aggregate at our council level and show without breaching any confidentiality rule that each state agency partners have. With that said, that doesn't mean we have a perfect, we have a very clear data sharing policy, but that does not mean we have already shared all pieces of data with all the agencies. We have policies in place, but we are working on agreements with each state agency partners as to what pieces of data will be shared and what is shared now, what do we need in 3 years down the lane, what we need 5 years down the lane, because we don't want to start sharing and housing data that we really will not be using. And then, and that's pretty much it. That's where we are.
This is Kim. In North Carolina, we generally use publicly available data. And we also, again, have been requesting this for many, many years, so those relationships are in place. Each year we do a data request to the partners for PBIS. I can tell you there is not a formal data sharing agreement that gets signed each year by all the entities, but those relationships, the history is in place for the sharing. And so a lot of that was worked out years ago, and it just rolls forward because we ask for the same information each year. I can also say that our money, even though we're an independent nonprofit, our money flows through the North Carolina Division of Early Childhood Development. And so that is one of our major data sources for Smart Start. So essentially, we are tightly coordinated with our major data partner through our funding.
Great. We are coming to the end of this webinar. I just want to say thanks so much to all of our presenters for taking the time to do these presentations and to share the great work that you're doing in your states. It is such an ongoing effort, and watching all three of you from the early days and seeing where you are now and knowing where you're going in the future is very exciting. So I look forward to sharing the story as it continues to evolve. And for some of the states who are on this webinar today, we're excited about the work you're doing as well, and watching your movement, seeing the potential for things like President Obama's Early Childhood Initiative that's going to help kind of push all states even further along. We have so much to learn from each other, and webinars like this are a great opportunity to at least start that sharing and learning. So thanks again to all of you for your presentations, and to all of you who participated in listening in on this webinar and sharing your questions as well. So thank you very much. Have a great day. Bye.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your line.